So we're going to be doing something very tricky in this session, and that's going to be understanding the fundamentals of research paradigms, particularly with respect to systematic reviews. So remember to like, share, and subscribe to this series. Let's go.
So research paradigm tries to make us understand that the belief system of a researcher can actually have an influence on whatever research he or she is trying to talk about. So we have to delve in. My name remains Innocent David Chercham. If you're listening to us from the podcast or anywhere, whatever you're doing, just understand that the research paradigms in systematic reviews is a very fundamental aspect, and it has its own pivotal contribution in how you come up with your question and how your conclusions, how the conclusions of the research, tends to be. So it's if you're somebody that tries to learn from experiences or beliefs, or maybe you deal with numbers, then it's worthy to know that how you shape your thoughts would have an influence, at least, on your research. It's a pleasure to have you. Now, so we'll start by looking at the outline for our session tonight. First of all, we're going to look at the hierarchy of evidence. We'll just have a look at the Pollitt and Beck hierarchy of evidence to know where our research is being directed to, because technically we are conducting everything we are doing here is centered on a systematic review. And to that end, it implies that understanding the hierarchy of evidence, where the systematic review is being placed, is going to be very important for you. So it's something very simple, and this is just going to have us know the roadmap of how we'll shape our belief system. And also we'll look at research paradigm properly, from a baby's view and also from an adult's view, to make our complexity simple. We'll look at some of the major research paradigms that we'll use. So if you're a PhD student, when you just started your PhD or you started your research, or maybe you're an undergraduate or you're a clinical researcher, postdoctorate, it's very paramount for you to understand how you reason. And you need to know that what we are saying in simple terms, you just think about it from the point that how we are trying to talk about, we're trying to relate that how you reason and how you shape your thoughts have a very significant impact on the conclusions and how you perform your research. Now, trying to look at the relationship between some of these paradigms and the methodologies that we have, and look at some of the examples of some research questions and their paradigms. Now, one might ask, why go into paradigms? Why don't we just finished our last session talking about some of the models in formulating a research question. It's very important to know that if you don't have an understanding of your paradigm, like constructing a very decent methodology in your research might really be a very big struggle for you. So, and that is why it is very important for us to shape our thoughts, make sure we communicate to the reader, mostly in your methodology. If you write your PhD thesis, you're usually asked to put your research approach. It sometimes can be, you see stuff like your research approach or your position, or maybe your methodology, whichever term, it's still the same thing. Try to understand how you want to shape your thoughts. Are you a positivist? Or are you an interpretivist? We'll all look at that on the later course of our discussion. Now, before we start, it will be very important for us to have a clear look again at what a systematic review means, right? A systematic review, you just need to remember that in a systematic review, right, it's just that type of research that tries to collect and analyze multiple, studies on a specific topic to find out the overall trends or try to draw conclusions from it. So we've said it 1,001 times that for you to conduct a systematic review, you just want to pick up evidence from diverse studies, right, and come up with conclusions. And that is why you just want to use a structured and methodological approach, which could be the Prisma checklist, the consensus, or whichever checklist that is of interest to you. But the idea is that you want to do something, you want to follow a particular guideline that is structured and methodological, and you have some articles in mind. So just see it as you want to know the number of babies that are suffering from neonatal jaundice. Now, how will you be able to know about this? That means you want to pick up studies on neonatal jaundice. Maybe the research question is prevalence of neonatal jaundice, and you've picked up a couple of research papers and you want to summarize them to come up with a conclusion. And now picking up those research papers means that you want to draw conclusions around them. Now, so for this definition, just to remember, for a baby, it's just like having a big puzzle that is made up of pieces from many different boxes, right? So a systematic review now is just like putting all these pieces together to see the whole picture and understand better. So it could be what I call a baby paradigm. Now here is the pictorial explanation of the hierarchy of evidence. And when we talk about the hierarchy of evidence, the idea is just to magnify the standpoint of a systematic review, right? A systematic review is standing at the top, systematic review and meta-analysis. So it means that what this evidence tries to talk about is that evidence from the base of this pyramid would not have a more stronger viewpoint compared to the one at the top. So it means that a systematic review, findings from a systematic review will be more preferred than a randomized control trial. And a randomized control trial is going to be more preferred than that of the cohort, and cohort is going to be more preferred than that of the case control, case series, and that of your editorial or expert opinion. So expert opinion here can be the doctor. So just think about the hierarchy of evidence as you want to get information from your doctor about maybe your spouse wants to use Postino 2 or any type of contraceptive. And that means that to talk about the effectiveness of contraceptive or Postino 2, now at the base of this pyramid being the editorials, this is what your expert has to say about it. Now it means that your expert opinion is going to be less taken compared to evidence from a case report. So it means that evidence from a case report on Postino 2 effectiveness is going to be more preferred, right, compared to that of an expert opinion. But rather, that from a case control study is going to be more preferred, is going to show more evidence than that of a case series and an expert opinion, right? Now, moving up from the ladder, the cohort study evidence is going to be more preferred to that of this, and this, right? That of your case control, case series, and editorials, right? And then also it implies that of the randomized control trial is going to be more preferred to that of the cohort, case control, case series, and editorials, right? Because most times in epidemiology, we usually state that to determine the effectiveness of any therapy, randomized control trial happens to be the most effective approach in determining the effectiveness of any therapy. So your doctor saying that Postino 2 or any type of drug, maybe metformin for type 2 diabetes or glyburide or whichever drug is more efficacious, right? We wouldn't really believe that evidence compared to that of the randomized control trial. So this is me just trying to explain the Pollitt and Beck hierarchy of evidence in simple terms. Now, you look at where the systematic review means. So if you're a systematic reviewer, you are really damn lucky because the systematic review is at the top. So it means that when WHO, the World Health Organization, wants to make a conclusion on any type sort of intervention, right? So it means that the World Health Organization or the Center of Disease Control are primarily drawing their evidence from what? Systematic review. So when we say COVID-19 in pregnancy, for example, during COVID-19, when my team and I, we got lots of publications for systematic reviews, we then will try to perform some kind of meta-analysis, but we weren't really finding studies. I think back then in 2021, right? But then we needed to include some couple of case controls, case series into as our included studies for systematic review evidence. But we really needed randomized control trials. So the point I'm trying to make now is that if we came up with the fact that maybe one of the COVID-19 drugs, or let's say, for example, Zidovin, right, which is maybe one of the treatment regimen for COVID-19 patients, is more efficacious, right? It's more effective than maybe placebo or any other sort of intervention. Now, to get that published, right, the WHO, if it wants to recommend Zidovin for pregnant women, it is going to be based on the conclusions we drew from our systematic review and not from what the expert is saying. So this is what we mean by what the hierarchy of evidence. But now, how does the paradigm come in here now? So it means that for you to perform all this sort of research, right? It means that what you must have a research paradigm where you're standing on, and this is where we welcome us to the world of research paradigm. So I'm sure you're very ready to take it on. So this is the baby welcoming us to the world of research paradigm. Now, so in simple terms, when we talk about research paradigm, not to make it broad, but to be very simple, it is just the belief system or worldviews that guide researchers on how to study reality. Right. So in terms of research paradigm, we're just trying to understand reality. Right. We want to know how do we believe truth? Because when we talk about research is all about truth. For you to say that COVID-19 reduces or COVID-19 could cause complications in birth, or maybe COVID-19 could lead to death, right? That is, for you to make that statement or to come up with that hypothesis, it means that that is truth or false. So how do we believe the reality that COVID-19 could actually do that? So it means that for us to come up with that conclusion, there has been some observations. So it could be that maybe we've had subjective observations, or maybe we've had observations by measuring data, maybe probably interviewing experts for them to say that COVID-19 could actually be can actually cause fatality in pregnancy. So that is just what research paradigm tends to be. So it's just that belief system. How do we believe that malaria could lead to maternal complications? A lot of studies has been done. Or how do we believe that malaria is prevalent in Africa? It is because we have collected quantitative data, right, across several regions in Africa, for us to now come up with that conclusion that malaria is is very fatal for maybe in Africa, or it tends to be a global burden. So that is just what research paradigm is all about. So it's just the framework. So just try to provide that framework for researchers to influence how we collect and interpret data. So that is just it. So I'm going to actually explain it in more details along the line. So now, one thing we need to understand is that when we talk about paradigms, right? So it's just very key for you to know that it could be qualitative, quantitative, or mixed in your approach or in your reasoning. Remember that paradigm is just all about how you reason. Their girlfriend came late to your house. Maybe probably you might have asked her some sort of qualitative questions. Why must you come late? Why are you not around? Why didn't you take the bike? That means you have a qualitative approach in asking questions. Or maybe you might use a quantitative paradigm to ask her, how much time did it take you? Or how much time does it take you to come out and all that? Or maybe you could actually use a mixed approach to do to understand your to ask that question, to shape your question, right? And that could be maybe using a combination of both quantitative and quantitative. So that is just what paradigm is. It's just all about how we view truth. How do we view truth? So in our last session, when we talked about models for formulating the research question, right? It's very, very paramount for us to know that our paradigm can also influence how we do formulate our research question. Now, let's get now into the business and make it more clearer. Now, we have three major paradigms in research. And one of the paradigms we have is Positivism. What we call Positivism, Positivism. Positivism. Right? So positivism is more related to quantitative paradigm. We'll look at that also. And another type of paradigm we have is what we call the Interpretivism. So interpretivism is also another major paradigm that we've got, right? And the next one we have is also what we call critical realism. So if you're starting your PhD and maybe probably you're writing in your methodology of your dissertation, or maybe your maybe any form of manuscript, and you're required to provide your research paradigm. So what the reviewer or your supervisor is trying to understand is that they are trying to ascertain how you shape your thoughts. Are you intending to carry out a qualitative research? Then if yes, that means you're likely to land yourself within an interpretivism paradigm. That means you're shaping your thoughts from what? From opinions, beliefs, and all form of experiences, and all form of elements that make up what? The interpretivism what? Paradigm. And let's say you're trying to declare that your paradigm is going to be the positivist paradigm. Then that means you're trying to ascertain that you're going to use a what? Quantitative what? Approach. And that means you want to talk about maybe measurable phenomena, empirical approach, you want to measure and all that, right? So we'll also explain all this in detail. And maybe you want to use critical realism. The vast majority of time it's used in trying to do what? Combine the approaches, right? In a major approach. But sometimes it can also be used for some sort of social related logic as with respect to your research question. So it means that if you've identified your research question to be quantitative, then it means that what? You want to use a positivist what? Approach in doing what? Answering this question. Now, when we'll be talking about the gaps in identifying literature, you will now tend to see how very important the positivism, interpretivism, and critical realism approach is to your what? Your study methodology. Now, are there other paradigms? Yes, we've got feminism, we've got constructivism, we've got pragmatism, we've got atheism, lots of paradigms out there. Remember, when you are using a feminist approach, it means that you're shaping your thoughts from what? Feminist gender, right? Or maybe let's say you're using a constructivism approach. Sometimes it's used in line with interpretivism, or depending on the context, pragmatism. So there are actually lots of paradigms out there. Paradigm is just all about how you shape your thoughts. So imagine your pastor in your church. So it means that most of his thoughts is coming from the paradigm known as atheism, or maybe other religious belief system. And that is how he makes his what? Judgment. And that is just what it's all about. So your research paradigm, you can ask your girlfriend, what is your research paradigm? So it's just literally how you want to shape your what? Your thoughts. And that is just it. So we'll just have a clearer look on the positivist paradigm. Yeah, we'll say, imagine you have a magnifying glass and you want to see things very clearly. Now, this is a very baby explanation of positivism, right? You have a magnifying glass and you want to see things very clearly. So positivism is just like using the magnifying glass to look at things closely and count them. Remember that when we talked about positivism, we talked about what? Numerical attributes, right? So that is just what it is. It is what it is. So positivism is just all about what? Counting any type of quantitative data or research question that you have. Maybe you formulated it using the PICO framework, or you formulated it using any type of quantitative approach that you're using to address your question. Then the positivist approach is going to be what? Best and appropriate for it. So just like trying to find out facts on that everyone can see and agree on. So maybe you're just counting how many toys you've got. And that is what positivism what is. Now, very, very simple and very, very easy. I'm sure everybody's really, really enjoying the series. And looking at interpretivism, so you can imagine the old woman in the village trying to tell you stories about what happened in the 80s. So in interpretivism, it's just like stories, experiences, opinions, people's opinion. It's not based on statistical data, facts. It's just what your grandfather told you. You want to now carry it on to the next generation and all that, right? So that is just what interpretivism is, right? It's just about understanding how different people see things and feel. So it's more like feelings, right? So before you go to bed, your grandmother is going to keep you, talk to you what her own mother told her and what her grandmother told her too. And you've got those stories. You have to laugh. You have to be cheerful, and in short, that is justice. So when you're working with any sort of qualitative research, interpretivism is the what? Fundamental paradigm. So just see interpretivism, see paradigms as qualitative, quantitative, and mixed method. Just see it that way, right? Quantitative is moving for positivism, right? You want to answer statistical related questions, whereas for interpretivism is moving for what? Qualitative. So how about critical realism? So you just take a story. Just imagine you and your friends are playing a game, right? But some of your friends are not having fun because the rules are not actually fair. Now, fourth thing is you use a magnifying glass to count how many times each friend gets to play. Maybe when they are trying to play that game, some of them are not given enough time to play on the snooker board. So imagine you went to play snooker and it gets to your turn and another person wants to also play on your own turn. So it's not different from what we're talking about, right? So this is just like using numbers to understand the problem because you're trying to use a magnifying glass to count how many times each of your friends gets to play. Now, but on the same hand, then you listen to each friend's story about why they are not having fun. Remember, you're counting and you're listening to stories, so you want to get their experience. So that's double now, right? So finally, you put both the numbers and the stories together to change the rules so everyone can now have fun. So this is like using what? Mixed method approach, where you use both counting and stories to make things better for everyone. So that is just what critical realism is just trying to look at. Remember that I also said that it can also be used as other logic, right? But this is actually a simple explanation of what critical realism. You're trying to mix the approach for what? Understanding. Remember, this is very fundamental when you're writing your methodology. When you want to write your methodology, you've just got to put in the approach, right? You've got to say, this is the method, you're writing your methodology, this is the paradigm that I'm adopting. I am a positivist. You talk about the strengths and limitations of positivism, talk about that of others. They tell us why positivism is suitable for a research question. Maybe probably because you feel like your question is quantitative, is dealing with measurable data, and you feel like that is going to be the best approach for you to answer it. That is just the whole idea for what? Paradigm. Now we'll get to see the intersection between paradigms and methodologies. And that is very simple, right? We want to understand another trait that we get to discuss whenever we're talking about paradigm. And that trait is usually what we call the ontology and epistemology. So when we talk about ontology, what we are saying is, how do we view truth? Now, it's just very simple. When you talk about paradigm, now let me make it clearer now. If you're listening to us right now, it is just very clear that when you talk about paradigm, there are two things that you're looking at before choosing that you want to use quantitative or qualitative or mixed method, or you want to use positivism, interpretivism, or critical theory, or also called critical realism. Now, what are the two things for you to look at, for you to now finalize? What two major things to look at now is what? Your ontology. How did you view truth? Ontology is all about how do you view truth, whereas epistemology is the study of what? Knowledge. So now what are we trying to say here? For positivism, the realism is just that there is single objective reality. So when we talk about objective reality, is that what? It is something we can measure. It's something we can see, right? It is single. When you're looking at your spouse, or you're looking at your girlfriend, you can count the number of fingers on her hand. So that is what, let's say you want to do a study on the numerical, or a study prevalence of number of fingers on the hand of your girlfriend, right? It is single. It is an objective reality, something you can see. You can say that she has 5 fingers or 5 digits on her hands, right? And then in terms of knowledge now, ontology, epistemology now, right? Remember, ontology is how you view truth. Because for you to say she has 5 fingers, it is a statement, it's a research question. What is the number of fingers on the hands of my girlfriend? Now, to look at the ontology now, right? It means it's something you can see. It's objective, single reality. You can see it. Now, how do you now draw knowledge? What is the epistemology? It means you can count it. You can now get the information by measuring it, by bringing her hand and counting You have 1, 2, 3, 4, 5. So you have 5 digits on your palm. So that means epistemology now, for you to say that it's positivism, means that what you can observe it. It's something you can measure. And now research approach to justify positivism is that it was quantitative, which we've already explained already. And some of the methods, designs is what we call surveys, experiments, statistical analysis. We already said that for all positivist paradigm, it is what? Quantitative. And what are type of quantitative studies is surveys, right? Some of your cross-sectional studies, your cohort studies, and all that, experiments, statistical analysis. These things are all what? All designs that are affiliated to what? Quantitative, which are measurable, because you can measure your cross-sectional study. You can count the number of students in your class. You can do an experiment and come up with numbers. This is effective because it is by 25% more reactive to this, and you can do statistical analysis to get p-values and all that, right? All these things are measurable, drawing knowledge from observation, and it's something you can see them. So that is why ontology is about reality. How do you view truth? Is from single reality. It's something you can see, something you can, it's objective, it's something you can counter. You can say, no, this hand is 5, this is 50 people. Based on epistemology is all about knowledge, right? It's something you can draw knowledge from statistics, and then it's the research approach is quantitative, and it's this. Now that makes it very fantastic. For our interpretivism research paradigm, if you're listening, then the ontology now is going to be, the reality now is relative, right? It is subjected, it's something that is constructed by individuals. So when your grandmother sits you down and she starts telling you about experiences of cervical cancer among women during her age, right? It is based on what? It's based on what? Subjective reality. You can't really see it. It's based on what she's constructing. And you draw knowledge from what? Experiences, subjectivism. Remember, the difference between epistemology and ontology is all about how you view it. So reality here now is constructed. You can't say your reality here is single or is objective because you can't see it. It's something that is constructed. Your grandmother is constructing a story for you. So the ontology of your position, of your paradigm is what? Constructed, right? It's something that is based on what? Experiences of patients, experiences of antenatal care mothers attending, maybe attending whatever. That is not something you can see. You're going to ask them questions, explore their experience, they're talking about it, you can't see it, right? Unlike when you issue them a questionnaire and they report their findings and all that. So here, for the epistemology of interpretivism, is based on what? Experiences. We already explained that. And the research approach is what? Qualitative. And the only way to, the research methods is what? Interviews, focus group. Remember, your grandmother sits you down, you by interviewing her. How was it during the 90s? How was it during the 80s? How was it during the 60s? Ethnography also, right? Good. Now that makes it very clear now for us to understand critical theory. So that means how are we now going to view it? So like we said, it can be viewed from both from a dualistic view, right? Like I said, it can also focus on social structures shaped by social, economic, and political factors, which are viewed from a dualistic position, right? Both from this objective and subjectivism. So this makes it more simple for us to gain knowledge. How do we now study the knowledge in our epistemology? So it means that we understand reality by critiquing and transforming social structures. Dualistic to mixed method. Some of them are what? Action research, case studies, participatory research, combining surveys with what? Interviews. That is what we talked about already. So I think this makes it very simple understanding ontology. That whenever you see the word ontology, you're asked what is the ontology of your research paradigm. You will say, okay, my ontology is based on single reality. I'm viewing truth. I'm going to view truth. I'm going to view my paradigm from a what? Single reality. It's something I can see. It's something that is objective, right? And what is now your epistemology? How do you now draw knowledge? It's based by what? It's based by measurement. I'm going to use measurement approach and all that. So what is now going to be your research approach? Quantitative. What is going to be your study design? cross-section. And that makes it very beautiful, and you're highly very well on point. Now, so let's get to some of the examples that we've got to make it very simple. So some of the new research questions here for positivism, which is quantitative, remember, is what is the impact of a new medication on the blood pressure levels of patients with hypertension? Impact. So this question now is 6 measurable objective data on the effect of medication. So this is clearly what a positivist paradigm. Remember that most teachings that you will actually find yourself with might not really focus on paradigm. You might not really get lectures on that because of most people just jump into the checklist. This wasn't really part of the Prisma checklist, but I tried to make it very easy and bringing it in so that we can also have the fundamental nitty-gritty of what research questions could actually turn out to be. So whenever your question has anything that is measuring impact or trying to use statistical method, it is going to be clearly what a positivist approach. So how does the rate of hospital infection change with the implementation of a new sanitation protocol? So the question focuses clearly, in this quiz, I'm just focusing on clearly quantifying the change in infectious rates. So it's going to be what? It's going to be what? A positivist paradigm. So some of other questions there is what's the relationship between daily physical activity and incidence of. So understanding the correlation between physical activity and diabetes is just going to come up with a numerical data, because at the end of the day, your conclusion here is not going to be based on experience. It's going to be based on what? Statistical data, where you can now come up with a correlation to say that this is the number, or this is this, or this is that. Now, moving further also, how do patients with chronic pain describe their experiences with healthcare providers? This is now about the interpretivist paradigm, right? So we're looking at experiences. So it's subjective, right? So this makes it even clearer. And also when we ask what are the perceived barriers to accessing mental health services? So understanding individual perspectives and barriers means it is going to be a qualitative approach, which is going to be interpretivist. So also, how do caregivers of patients with Alzheimer's disease experience and cope with their caregiving experience? So we can go on and on with examples, and this continues to make it so simple and easy. Now we might want to have a test of the critical realism paradigm, where we can actually say how do socioeconomic factors influence access to healthcare in urban versus rural areas, and what are the lived experiences? So when you look at this question, it's just trying to combine statistical analysis of right, with what? So when you look at this question, you see that it's trying to combine statistical analysis with experience. And also for this other question here, where we are now asking, what are the effects of healthcare policy changes on the quality of care provided to marginalized communities, and how do these communities perceive response to these changes, right? So this is also another question that tries to use both approach. So here we've got practice questions that are very relevant for us, and we can always put them into practice to make more sense to what we want to do. And and that's what it's going to be. And you can just go through the practice exercises. And yeah, so I'm just going to have a rundown of what I've talked about from the beginning, where I talked about the hierarchy of evidence, research paradigm, major research paradigms, relationship between research paradigm and methodologies, examples of research questions and the paradigms. Then I made it clear that systematic review is all about trying to collate research from multiple studies on a specific topic to find overall trends and draw conclusions using a structural and methodological approach. And it's just like, we made the baby approach very clear, and we make sure that we explain that the systematic review evidence is at the very top of the hierarchy of evidence, and it's going to provide more evidence compared to others down there. And we talked about research paradigms. It's just as the belief system or worldviews that guide researchers on how to understand and study reality. And they provide the framework for researchers, influencing how they collect and interpret data. Understanding paradigms helps ensure consistent and coherent research. So we made it clear that we've got three core paradigms, which is positivism, interpretivism, and realism. And we said that positivism is just all about quantitative, tries to look at quantitative aspects of any type sort of research question that you've got, and just deals with counting. Whereas interpretivism deals with experiences, qualitative data, and all that. And we said that criticalism could be a combination of it, and also social and economic factors can also be used to explore critical realism. And we made a very clear example where you have your friends playing a ball and you're trying to solve that problem using two approach. And we now try to explain the intersection between these paradigms and methodologies, where we explain the ontology as how we view truth, epistemology as how we study knowledge, research approach as whether it's going to be quantitative or numeric, or qualitative or a mixed method, and example of methods that we use. And we now say that for positivism, it comes from a single reality, right? Where where you something that you can view clearly, and the knowledge that you draw from there, which is epistemology, is by measuring and observing, right? It's something you can measure and observe, and it's quantitative. We make for interpretivism that it's very relative, and that each reality is constructed by individuals, right? And we understand each reality through the meanings and experiences of individuals, right? So it's solely based on experience, and qualitative, and it's interviews as well. And now we made it clear that for critical theory, it could be a combination of both using mixed method. And we saw lots of examples. And for example, we are clearly able to dispute that measuring, any sort of data, it's clearly quantitative paradigm, which is positivism. Whereas for exploring experience, perspectives, and all that, right? It's for interpretivist paradigm. And critical realism is any sort of question that has a combination of this. And all these questions are actually explained here well in detail. So we've got practice exercises that we have to match to paradigms and get these things done. So in our next session, we are now going to take on how to develop research rationale and clearly identify gap in literature using a well-detailed practical session. So thank you very, very much